It's another day with the physicians where your health is our business. The growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have your hormones.
And I don't know about any other one, but what you know,
You're welcome back to the training of your regular program.
We can just say nutrition is whatever you're eating, you're assimilating to be able to grow, reproduce, and maintain your lifestyle.
The thyroid gland is a small organ that's located in front of the neck, wrapped around the windpipe, also known as the trachea. It's shaped like a butterfly, smaller in the middle, with the two side wings that extend around the side of the throat. Your thyroid creates and produces hormones that play a role in many different systems throughout your body. When your thyroid makes either too much or too little of these important hormones, it's called a thyroid disease. Thyroid disease, therefore, is a general term for a medical condition that keeps your thyroid from making the right amount of hormones. Your thyroid typically makes hormones that keep your body functioning normally. What is the thyroid? What does it do? Who is affected by thyroid disease? What are the possible causes? Today, on your favorite TV health talk show, The Physicians, we shall be discussing thyroid disease, risk factors, symptoms, diagnosis, management, and of course, the prevention. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your regular host on this program. Today we'll be discussing thyroid disease, the risk factors, the causes, the prevention, and of course possible complication and diagnosis. We have in the studio our guest. He is a consultant endocrinologist, Dr. Aramide Adediran from the General Hospital IFAKO, IJAIYE. She's also a member of Endocrine and Metabolic Society of Nigeria. In fact, her CV is very, very long. But for want of time, we just want to go straight to the program. Welcome to our program, The Physicians, Dr. David Adeniran. It's nice having you on the program.
Thank you.
Welcome.
Thank you very much. I'm happy to be here.
Thank you. So before we go for our viewers out there, what is the thyroid? Give us a general overview of the thyroid, its location, and what does it do?
Thank you very much, Dr. Martina. The thyroid gland is an organ that is located in the anterior part of the neck, just in front of the trachea. It is butterfly shaped, right? Now, this organ is a very small organ. Ordinarily, is not seen by anybody. It's not prominent. Now, in some situations, the thyroid gland itself, well, the normal function of the thyroid gland, it produces hormones we call the thyroxine, that's the T4 and the T3, but more of the T4, which is converted in the periphery to T3, which is the active one, is the one that is really active, and is the free form that is active. Now, the thyroid hormones are very important when it comes to the metabolism of the body. You know, that is the function of every organ and every cell. You need a thyroid hormone. That is why when we have diseases of the thyroid organ, it affects the whole body. The cells are affected. For example, it spans from hyperthyroidism, excess production of the thyroid hormones, to hypo, low production of the thyroid hormones. Now we have different causes for this scenario. Let's look at the hyperthyroidism, in which you have excess production of the thyroid hormone. You have the autoimmune condition. Now, one thing you must note before I go further, the thyroid disease is very common in the female gender.
Why is that, sir? Any reason?
No reason. But we found it to be more common in the female gender than the male gender. In fact, we have a 9-to-1 ratio.
9-to-1 ratio?
Yes.
That's high.
It's quite high. Now, when you have hyperthyroidism, when you have excess production of thyroid disease, you could be as a result of an autoimmune condition, in which, of course, you have antibodies to the thyroid gland being produced.
When you say autoimmune, what does it mean?
Yes. Autoimmune means that the body develops antibodies that attacks the cells of the thyroid gland and either causes excess production of hormones or reduces the production of hormone. So it's autoimmune, antibodies, and in such cases, you find antibodies being produced.
So what it means that your own body is producing what?
Exactly, to damage its own body.
Wow.
You know, so you have autoimmune conditions. Then in some cases, you have a nodule, we call it thyroid nodules, could cause excess production of hormones. When you examine the patients, you will find out that they have that nodule. Maybe in one of the glands, you know, you have the
butterfly
two lobes,
yeah.
Yes, and the isthmus that joins the two lobes.
Okay.
So you could have the nodule anywhere, you know, and by the time you examine the patient, you will see it, you know. And in some cases, it could be multinodular toxic goiter, very big multinodular, different nodules, you know, on the thyroid hormone. Now, hyperthyroidism, I will deal with the symptoms of hyperthyroidism.
Okay.
When a patient comes in with hyperthyroidism,
So now you want to talk about the common types of thyroid disease that we have?
yes.
Okay, so starting with hyperthyroidism.
Hyperthyroidism.
Okay.
I've told you it could be autoimmune, it could be toxic nodular, it could be multinodular, toxic, multinodular goiter.
Okay.
When we say toxic, which means excessive production of the thyroid hormones. Now, these patients, how do they present? They come in, they complain of weight loss, you know, excessive defecation. It's not diarrhea. We call it hyperdefecation. Normal stool, not watery, but when they eat, they go to toilet. When they eat, they go to toilet. And they find that they are eating a lot. Yet they are not increasing in weight.
Okay.
And then you find that they are anxious. They have this anxiety. And then they complain of palpitation because of the excess hormone.
They have tremors?
Hyperactivity. They have tremors. In fact, when you examine them, you see that they have fine tremors on examination, you know. So they come in with these symptoms. And when they come in, of course, by the time you do the investigations, of course, the thyroid hormone, the TSH, you know, the TSH is like from the brain, controlling the production of thyroid hormones from the thyroid gland. You know, so when you do all those tests, you're able to hit it, that is the thyroid causing a hyperthyroidism. Now, there's some rare conditions. We call it the TSHomas, in which you have the tumor of the TSH producing cells in the anterior pituitary gland.
So the TSH is the thyroid stimulating hormone.
Is a thyroid stimulating hormone. So it could be there could be excessive production from a tumor in the pituitary. Of course, when you do an MRI, you'll find that. You know, so in such cases, you'll find that the TSH will be high. Of course, from the blood picture of the thyroid function test, you'll be able to, you know, have a high index of suspicion that this is what you're dealing with. And of course, you confirm using the MRI.
Okay.
Are you getting what I'm trying to say? Yes. And of course, if it's autoimmune, you find the antibodies being very high in such cases, you know, for the hyperthyroidism.
So for the hyperthyroidism, for those patients, do they also sweat excessively?
They sweat excessively. They have heat intolerance. You know, when other people are okay, it's like they feel heat. You know, they have this
Internal
heat intolerance,
heat.
internal heat, exactly. They can't tolerate heat at all because of the increased metabolism.
Okay, so let's just clear a gray area. You talked about the prevalence being more in females than in males, 1 to 10. And you also talked about this heat intolerance.
Yes.
So then let me ask you a two-pronged question. For the female who has age got anything to do with it? That's number one. Why am I asking this? So we can know if for menopausal women who also have the symptoms of like sweating excessively, of heat intolerance, if they also have, how do you want to differentiate this? So has age got anything to do with it?
Very good question. Very good question. For the autoimmune, we call it Graves' disease. It's very common in the younger age groups. Now, when you see a patient with postmenopausal symptoms, it's a differential diagnosis. Of course, your thyroid hormone, your thyroid function test will be able to clarify it, you know. And by the time you are seeing such a patient, is having tachycardia, hyperthyroidism, the pulse rate is usually very high. Are you getting my point? So you'll be able to differentiate. Of course, when you do the hormonal profile of the patients with the postmenopausal symptoms, you will have it shown. So it's actually a differential diagnosis, but with the investigations, you'll be able to differentiate.
So the Graves' disease is more with the younger people?
It's more with the younger ones.
Okay. How about this one that have this the eyeballs that usually pop?
Yes, those are part of the symptoms
of the hyperthyroidism.
Yes. Some patients, not all patients. Not all patients present with it. The Graves' ophthalmopathy, especially in Graves' disease. Graves' ophthalmopathy, in which they have the eye symptoms, you know, in different gradings. Some will need intervention, and some will just need some things just to prevent the eyes from getting too dry. You know, by using artificial tears and then using ointment. But in some patients, they may need orbital decompression. You know, like that. Yeah.
Okay. Now you see before you go to hypothyroidism, still on hyperthyroidism, and knowing that it has to do with the women also, I want to ask, does it affect their menstrual cycle?
Yes, it does.
Okay.
Yes, it does.
So it increases.
So it increases flow.
Okay.
It increases flow. Now there was one cause I really didn't mention. You know, there could be cancers of the thyroid gland, presenting as features of hyperthyroidism. But of course, investigations will also reveal to us that we're dealing with a cancer.
Talk about the increase in hormone for hyper?
Yes.
So how about the hypothyroidism?
For hypothyroidism, they have a reduction in hormone production from the thyroid gland. Now, how do they present? They come in with slowness. There is increase in weight, cold intolerance, complaint of constipation, you know, things like that.
Wow, unlike the other one, that was a frequent
defecation.
Hyperthyroidism.
Exactly. So it's
for
the
opposite. Okay,
for the
so it's constipation.
Thyroid patients. And in the hyper also, they could come in with insomnia.
Lack of sleep.
Lack of sleep. For the hyper also. Hyper could come in with lack of sleep. And these ones have excessive, you know, somnolence.
Okay. Yeah. Is there like a familial history?
Yes.
In hereditary?
Yes. You could have a family history of it. You could have a family history, both of hyper and of hypo. And of course, even hypo has the autoimmune cause, in which you call the Hashimoto thyroiditis, you know, in which of course they also have antibodies to the thyroid gland, you know. And of course, as I said, with investigations, you find it out. You could also have conditions, different causes of hypothyroidism. You could have a postpartum thyroiditis. Are you getting boy? Now, for postpartum thyroiditis, after about 6 weeks with treatment, it disappears. But for some of the patients, for a certain percentage of the patients, they could end up with hypothyroidism. hypothyroidism.
Okay.
You know, then you have some that is a viral infection that comes in. We call it the decurvent thyroiditis. You know, they also, it's a viral infection. All these Coxella and all that viruses can come in and cause hypothyroidism in such patients. Of course, those ones too could be transient. You just treat with
It's getting very interesting.
Yes.
You talked about the hyperthyroidism. We've talked about the hypothyroidism. These are the thyroid disease. Which other disease do you want to talk about?
You could also have the Riddle's thyroiditis.
Riddle's thyroiditis.
Yes.
Dr. Please just hold it there. When we come back, we'll talk more on the Riddle's thyroiditis. I'm sure it's very, very interesting. Our viewers out there, we need to keep a date with the physicians. Let's hear what you have to say about thyroid disease. Have you heard about it before? The disease that affects a gland that is usually located on the front of the neck. Some people will call it like a butterfly. So let's hear from you what you have to say about it.
Yes, I've seen a woman that has a swollen neck before.
Yes, I have. I've seen someone with a swollen neck.
Yes, I have.
No, I've not.
Yeah, goiter, that's the word. Goiter. Goiter, that's the word.
That's goiter.
I don't know the name.
I can't really say because I don't have an idea of what's responding for it. I just know it forms at the neck.
You know, there's an element. Though that element might be found in another thing, in another substance, but it is also found in the onion. If somebody lacks that element, such a person can have the disease.
I don't know. I'm not an health personnel. I don't know.
Welcome back. If you have just joined us here on your regular program, The Physicians, where your health is our business. We've been talking about thyroid disease, and in the studio we have Dr. Aramide Adediran. She's a consultant endocrinologist from the General Hospital, IFAKO, IJAIYE. Before we went on break, which was going to talk about the other type, the Riddle's thyroiditis. And I think we will need to continue from that place, Dr. Aramide. So let's talk more. You talked about the hyperthyroidism, we talked about the hypothyroidism, and you were going to talk about the Riddle's thyroiditis before we went on a short break. So let's continue from there.
Yes, thank you, Dr. Martina. Now, the Riddle's thyroiditis is also another cause of hypothyroidism.
Okay.
In this form, you have fibrosis of the thyroid gland, and all this, and some surrounding organs, even to the mediastinum, there's fibrosis.
When you say fibrosis, for the purpose of our viewers out there, what does it? Is it like a sponge or something?
How will I do? I'm trying to use the layman's language
Right.
now. When I say fibrous tissue, it becomes
Like a bit brittle.
thickened,
Okay.
non-functional.
Okay.
You know,
Okay.
it's like it
Just
just
there.
stay.
Okay.
You understand? And so
Okay.
not producing enough thyroid hormones.
Okay.
And even other surrounding organs. You know, the parathyroid hormone lies just behind the thyroid gland.
Okay.
That one also gets fibrosed.
Wow.
So the patient
they're
now
not
has
functional.
hypoparathyroidism
Wow.
alongside with it,
Okay.
with some other organs. So that's another cause of hypothyroidism. Are you getting what I'm
Okay.
trying to say? So usually, of course, steroids.
Okay.
They use steroids, systemic steroids, to manage such patients. Now, when we're talking about hypothyroidism, I told you Hashimoto is also there as an autoimmune, in which you have, by the time you are doing the investigations, you do the thyroid function test, you find out that the hormones are low, and then the TSH is high. That's the thyroid stimulating hormone, and of course, if it's an autoimmune, you find out that the antibodies are also increased,
Okay.
in these patients. Of course, you go further to do a fine needle aspiration cytology to find out, are you dealing, both for the hyper and the hypo, are you dealing with a malignancy?
Now you're trying to tell us about the diagnosis, how to make the diagnosis.
Yes. Are you dealing with a malignancy? You also need to do the thyroid ultrasound scan, to know, are we having a retrosternal extension? Because you have some patients, they are euthyroid. I have not talked about the euthyroid goiter.
Yeah.
This is, you have the thyroid gland being enlarged, but the hormones are normal. That's a euthyroid goiter. It's a thyroid disease also. Now, where does that have a problem? You could have a substernal retrosternal extension.
That is not, you can't say.
You know, you, of course, you cannot get below it by
Yes.
the time you examine the patient. The thyroid ultrasound scan will pick it for you. Even with your examination, you will find out, of course, when you pass over the sternum, it's dull. So you know you have, of course, you can't get below it when you examine it. Now, the problem with this is that it could compress. You know the trachea is just directly
so you have
behind
difficulty
it.
in
Difficulty
breathing.
in breathing. So you find they come in with stridor. The patients are having it difficult in breathing. For such patients, you just have to remove it.
Okay.
You know? So treatment for the hyper, it could be medical, using drugs like carbimazole, you know, surgical, doing a surgery to have a total thyroidectomy or subtotal thyroidectomy.
Okay.
You could do a radioiodine therapy,
Okay.
you know, to ablate the glands. You know, so those are ways in
Okay,
which you
one can be
actually
managed.
manage. Yeah.
Okay, so you have talked about all these ones, the hyperthyroidism, hypothyroidism, and more common in the females than in males. I'm sure my viewers are there waiting. So how do we manage this? Is there any dietary thing? What are the different management methods that you would advise? Because in the past, people will tell you because of the iodine, you need to take a lot of salt.
Yeah.
And so also, before I even forget, some people will tell you
Low
in some
iodine.
parts of the region where you come from,
Yes.
those that come from a particular region, they have it more because of the salt, iodized salt, and all those stuff. So we want to throw more light to this, so we'll know.
Yes, we find it in places where they have low iodine, and it's found in these mountainous areas.
Okay.
You know, those that come from those hilly areas. So of course, when you are taking your history from the patient, you are going to find out where that patient comes from, because most of our thyroid diseases are as a result of low iodine therapy. Now, we must also note there's something we call factitious thyroid disorder, hyperthyroidism. Patients could deliberately be taking thyroxine to lose weight.
Seriously?
Yeah, so you have to be very careful. When you are taking your history, you have to be very, very careful. So you can be able to get that history from that patient. So it could be something that
Thyroxine to
lose weight.
But they don't even know the things that come with it.
Exactly. So you have to have that at the back of your mind also. You know,
Females.
when it comes to that, you know. So when you take your history, where is this patient coming from? Because a lot of time is related to, you know, deficiency of iodine.
Okay.
You know. So of course you encourage the use of iodinized salt
Okay.
in them. But of course when you catch such patients, they have to see their physicians and they have to have the appropriate. Of course you give the patient the wide range of treatments, the medical, the surgical, the radioiodine therapy. The patient has a right to choose, you know, but of course you direct the patient appropriately depending on how the patient is presenting. And of course you know that when a patient has hypothyroidism, you know we need this thyroid hormone for the metabolism of the body. You find out that a lot of them with hypothyroidism will have disorders of lipids.
Okay.
You know, also again because of the effect of thyroxine not being present, you know, the liver itself is not able to clear the body of the bad cholesterol.
Okay.
So they come with
High
this-
cholesterol.
exactly.
Wow.
You know, so you see that
And
relationship.
the
You can
challenges
see-
of high cholesterol come with
Exactly.
it.
So
High
you
blood
have
pressure
to
is
put
also
that at the
very
back
as a
of your
risk
mind.
factor.
Exactly. Hyperthyroidism is also associated with high blood pressure
Okay.
and arrhythmias. So you see, you have to, and then we have to, when you are treating them, you have to make sure that the patient understands what he's treating, to know that there are complications to these things if they don't take their drugs regularly.
Thank you very much, Dr. Aramide Adediran. It's been a
Martina.
pleasure having you
Thank you.
as our guest, an endocrinologist. We know we don't have so many endocrinologists in Nigeria. At least having you still around is a whole lot of. We're actually very grateful because I know many of them have actually relocated. But you stayed back and you're actually giving service back to the society. We appreciate you, and I'm sure we'll see call again. Because we don't have so many endocrinologists, so just be rest assured that we'll call again, and I know you will answer. Thank you, and we really appreciate you. And to our viewers out there, I'm sure you've heard all that she had to say about the thyroid gland, the symptoms, ensure you try as much as possible to see your doctor. At least do your annual check. Like we had before Rufus and I told her, it would be very nice if most of us can actually do our annual checks on our birthday. Give that to yourself as a birthday present, as a birthday gift, and just do your annuals. When you do that, you have a baseline and be able to check if there's anything. If anything goes wrong, it will be detected early. So this I want to say thank you so much for keeping a date with us again on your regular program, The Physicians, where your health is always and always our business. Remember to follow us on our social media platforms and on Instagram, Facebook, YouTube. And if you want to be part of this program, our website is up and running. Just go there, complete the form, and we'll get back to you. Same time next week, keep a date with us and remain blessed. I still remain Dr. Martina Adediran. Take care.
Hello everyone, my name is Dr. Izuhunwa Amadasun. I'm a medical doctor, I'm also an entrepreneur and author. And today I've been talking about my experience as a cancer survivor, sharing a lot about my experience, my journey with that whole thing, and it's really to enlighten a whole lot of people out there, for those who have been through cancer, those who know people who are going through cancer. This is really good and important information many people need to know, and these are the kind of things that we cover on the show The Physicians. So do keep watching. This is a brilliant show.